I see that one of you is from DC, the other is around the DC area. So I'm sure a lot of politics from DC may be coming here. But anyway, my question is, first of all, I want to just be clear. Are you a representative or an advocate for Kratom or no? You're just a consumer advocacy agency, or what relationship do you have with Kratom?
So my hat is that I represent the American Kratom Association, a consumer-based organization advocating for the 15 million and growing number of Americans using Kratom. I also am here as a Kratom consumer. I use Kratom, have been for the last 6 years regularly. I'm an old guy, and it helps me with arthritis and pain and that associated with it. And I also injured my knee a couple of months ago, so I've increased the amount of Kratom. I'm not going to confess that the last time I took some Kratom, because I'm here in Wisconsin, but I'm testifying to you under the influence of Kratom. Now, if anybody thinks that I'm delusional, maybe I am. If anybody thinks that I'm impaired in some way, maybe you have to see me when I'm not, I don't know. But I don't think that people that make claims about Kratom impairing you and somehow, and as Dr. Henningfield said, that when you look at the research, it actually is more alerting. It helps you increase focus, and it takes responsible use. Can you abuse Kratom? Absolutely. You can abuse any substance that you choose. Responsible use, and the key to that is good labeling, good instructions on how people should properly use it, and we advocate for that. We think it's an important part of the experience of using Kratom.
So you also, then that means basically you're being somehow paid by Kratom to do the work that you do. That is true, right?
Oh, absolutely. I'm employed by the American Kratom Association.
Excellent. So you also presented yourself as a consumer advocate. What other products do you advocate for outside of Kratom?
Other substances?
Yes.
Well, I've been in this space for about 40 years. I had a brief time. I served in the legislature in Utah, so I'm a recovering politician. I served as the chief of staff, Department of Health and Human Services. I worked for Senator Orrin Hatch when he served, and in my career in the advocacy space, I've worked with dietary supplement groups for at least 35 years, advocating for the right of Americans to have the freedom to make choices about responsible use of dietary supplements, which the FDA doesn't like any more than they like Kratom, but they have to live with it because the federal government implemented the Dietary Supplement Health and Education Act in 1994, which, if the FDA had their power, they would repeal that bill today. They hate dietary supplements, but 80% of the Americans use them and report they're having great effects by them, and it's a $100 billion industry. So consumer acceptance of products the FDA doesn't necessarily like isn't the criteria. It's about how it's helping people, and that's why I referred the representative to listen to the Kratom consumers here today, their experiences, why it's helping them, and I think you'll see why I'm so passionate about advocating for them.
May I add something? I helped develop buprenorphine, and I've consulted on that, and I'm proud of it. It saves lives, but it's not for everybody. And one of my colleagues in Johns Hopkins, when she heard what we were doing in the Kratom space, she sent me a very personal note thanking me for the effort. I said, Meg, FDA is wrong on the science and the policy, but this is about millions of people for whom Kratom is a lifeline. Got a note back, Jack, my son is one of those people. I shiver when I say it because he went to school with my son. He almost overdosed with opioids, got into buprenorphine treatment. It stabilized him, but he hated buprenorphine. He couldn't function. He tried Kratom. And she said, we were nervous about it. She's board-certified addiction specialist, professor at Johns Hopkins. And she said, over the next 6 months, he got his life back. And that's what the most common refrain that I hear. And in terms of consumer access, that's vital. I worked on a new form of naloxone, or Narcan, and the company jacked up the price, and it wasn't going to help people. So my group formed Harm Reduction Therapeutics to make it truly over-the-counter, non-profit, and it was approved by FDA last July, and it'll start shipping mainly to states to help states save money by getting Narcan much lower and being able to put it in gas stations where people need it. So I'm not a kratom advocate per se. I'm a scientist. I follow the science, and I serve public health. That's why I'm here.
Just to follow